How long does it take for cleaning pills to work after an abortion?
Hello everyone. Today, we're going to discuss a very important topic, post-abortion care and the role of cleaning pills. In the aftermath of an abortion, many women take what are known as cleaning pills to ensure the body is fully cleared out. We'll delve into how long it takes for these pills to work and how they impact the recovery process.
What are cleaning pills?
Cleaning pills, also known as misoprostol or Cytotec, are medication used in the process of medical abortions and post-abortion care. Their main purpose is to expel any residual tissue left in the uterus after an abortion. This can help prevent complications such as infection or heavy bleeding.
How long do cleaning pills take to work?
The exact timing can vary from person to person, but typically these pills begin to work within a few hours of ingestion. Their effect usually induces cramping and bleeding similar to a heavy period, which is the body's way of expelling any leftover tissue. This process can last from a few hours up to a few days, depending on individual factors.
When does recovery happen?
Recovery from an abortion varies widely for each individual. While the physical effects of the cleaning pills may subside within a few days, the body needs time to heal completely. Most women return to their normal activities within a week, but full recovery may take a few weeks. It's important to follow all instructions provided by your healthcare provider to ensure a safe and effective recovery. In conclusion, cleaning pills typically start working within a few hours and their effects can last for a few days. However, the full recovery from an abortion, including the effects of these pills, can take a few weeks. As always, consult with a healthcare professional for personalized advice. Remember, your health and safety should always be the top priority. We hope this video has been informative and provided some clarity on the process. Thanks for watching.